However, the most important thing is you need comprehensive knowledge of anatomy, especially vascular anatomy, in order to minimize the vascular complications. So our blood supply to the face comes from common carotid artery. The power of the common carotid artery can be felt here at the arterial border of the sternocleidomastoid muscle in the level of the thyroid cartilage, and then it will come up and give rise to the external carotid system and internal carotid system. Because today I will address at the frontal area, so you need to know three main branches of the vessel that supplies forehead area: supratrochlear artery, supraorbital artery, which is the branch of the internal carotid system, and superficial temporal artery, which is the distal end band of the external carotid system. So
when Dr. Rungsima texts me and asks me, Silvia, can you do the presentation about this title? Then I look up at these pictures, then I'm thinking, where should, is there any place that we can say that it's safe to ask for us to place the fillers? Because we can see the vessels here, we can see the anastomosis, we can see the connecting between one vessel and another is so crowded, especially around the forehead and especially around the glabellar here. But we know from the study, many study has been revealed, we know there is some place that we can use it safely to put our filler there. So based on the paper, it said that forehead is one of the dangerous areas for put filler in, and especially in the glabellars and the nose area. So these three, the forehead, the glabellar, and the nose, is the very, very high risk for put filler in. And the far away you from the forehead, the safer you will be. The less risk you will be if you far away from the forehead. For example, the chin area, the mental.
And as an overview about this slide, I will talk about the background, the tips and tricks in beautifying forehead, and also I will add the male versus female forehead technique and also the science behind it. As a background, forehead, it occupies 1/3 of the face, thus is an important factor in people's appearance. It's also a strong indication for masculine versus feminine faces criteria. In women, what is considered beautiful is a broad, convex, and smooth forehead compared to the flat or hollowness of the forehead itself. And as we age, the forehead undergoes also aging, which will have signs and symptoms such as eyebrow ptosis, forehead wrinkles, and asymmetry. These are the tips and tricks from the assessments to the filler selection and pre and post procedures that I will talk tonight. Actually, those differences are rooted deep down from the bone, because from this journal also we can see that male forehead skull is actually more oblique compared to the straight and rounded forehead of a female. And we can see the prominent supraorbital ridges from men is rooted from the skull compared to the subtle or even absent supraorbital ridges of the female. And we can see also in the skull of male, the glabella is more pronounced and compared to the delicate glabella of the female. Therefore, by gender dimorphism, what is considered attractive in male is somewhat of the flat forehead with a pronounced supraorbital ridges and glabella.
But one thing I normally, before I inject forehead, right, I always pinch the forehead skin, you know, because it really varies from one patient to another, I find. Some patient, because if you do, all of you, I think, do Altera, you will know that some patients you need 3 millimeter depths only, but some patients you can't even go 3 millimeter depths, you know, you need to go to 1.5. So we know there's different thickness there. And when it's very thin, the skin over there, it's so difficult to inject fillers on the foreheads without leaving any lumps and bumps.
I usually don't give the nerve block because, you know, like I want the patient to feel a little bit pain, because if there is a, you know, you inject it into the vessel, the artery, the first side is the pain. So I want the patient to feel pain, so the patient can tell me the symptom. Another, if you inject the local anesthesia with adding epinephrine, it will create some vasoconstriction, and it will like confuse when you get the complication, because is it from the adrenaline, or is it from the vasoconstriction from the emboli? Yes. So